So, thank you. So Representative Kildee said something really scary, and I think a lot of us have already read this in the paper, including by articles that you've written. But the child who said, "I'm afraid I won't be smart." Imagine if that was your child. That person, that young person, is going to carry that question their entire life. They're not going to forget about this event. And then they're going to question, there's a risk of them questioning themselves. That's a profound tragedy that can't be measured in blood lead levels or parts per million. So I wonk out a lot. I talk about parts per million a lot. But that is something that's much more important and much more profound than the wonking out that I'm about to do. So I just wanted to start with that. So a few months after Katrina, I went to New Orleans. And when I went there, I saw the devastation firsthand in a way that I experienced as profound. And when I visited the most affected areas, the local activists made it clear to me that the poor and mostly African-American neighborhoods that bore the biggest brunt of the storm's effects, that wasn't by chance. It wasn't by chance that those were the communities that bore the most effect. It was a result of a long history of racial discrimination that left these residents most at risk. And I start with Katrina because I want to say that the water contamination in Flint needs to be in the context of the history of environmental injustice in our country in general. This is a manifestation of a problem, not the problem itself. Across the country, people of color and low-income communities remain unfairly at greater risk from cancer-causing chemicals, chemicals that cause acute and chronic health problems, and chemicals like lead that can cause lifelong learning, behavioral problems, and health problems. In areas like Flint that have long histories of environmental inequities, where residents already suffer health problems from environmental stressors, a crisis like lead contamination of the water supply is likely to cause even more severe effects. For this reason, solutions have to have a broader context at looking at the environmental and health improvements from the community level for those communities most already at risk. Congress needs to work directly with affected communities in Flint to resolve the water crisis. In Flint and in other instances of environmental injustice, the community's experience of racism and injustice has to be at the center of any process of resolution. We have to be more aggressive in bringing those communities' voices into discussions like this one here right now today. The people who are most affected have unique expertise. They know something that nobody else knows. And they should be given a larger platform so that they can speak for themselves and provide leadership.